On here.
Hello, welcome to the Google Hangout with Pregnancy Magazine and preeclampsia.org. Today we have Eleni Segas, the Executive Director of the Preeclampsia Foundation. She has served in a variety of volunteer capacities for the organization, including 6 years as on our board of directors and 2 as its chairman. She's worked with many dedicated volunteers and staff members to really bring this to a nationally recognized resource for information, research, and support related to preeclampsia. Today we're going to be talking with Eleni about the symptoms of preeclampsia in the post-preeclampsia period. So Eleni, to start out, what are some of the common symptoms of preeclampsia that our patients should be watching out for?
So, Lainey, the interesting thing about preeclampsia symptoms is they're often referred to as non-specific, which means they aren't symptoms that only mean somebody has preeclampsia. And that's one of the reasons we really need to make sure that patients are aware of what those symptoms are. So today we're going to be looking at the 7 most common symptoms and recognizing that all women don't necessarily experience these symptoms the same way. So real quickly, I'll do a quick run through of them, and then we can kind of back up and spend a little more time on them. And I probably should back up and say, you know, when we talk about preeclampsia, that's a mouthful. Most people maybe haven't heard the word. It is obviously a life-threatening condition of pregnancy, and the most common way that people know about it is because it is associated with high blood pressure in pregnancy. But there are other symptoms, swelling, and interestingly, this is not the swelling that almost every pregnant woman has in her feet and ankles. This is more the swelling that might happen in her face and especially around her eyes and in her hands. That kind of swelling is more concerning, and that would cause, really, a woman should be seeing her care provider, a doctor or midwife, if she's having that kind of swelling, particularly if it's sudden. And that often accompanies a very rapid weight gain, which is another indicator that something could be wrong. So women who are gaining more than 5 pounds in a single week during pregnancy, and especially in the latter half of pregnancy, warning, warning, that shouldn't be happening. So that's a good reason to go see a care provider. Headaches, nausea, visual disturbances, these are 3 other common, I shouldn't say common, indicators that something may be wrong. I say common because you could have a headache just because it's been a stressful day. You pop a couple Tylenol and it goes away. That's not a concern. When you have a headache that's not going away with acetaminophen or Tylenol, that's a concern. Same thing with visual disturbances. If you're seeing spots and auras and maybe losing your vision, those are big indicators that there may be pressure in your brain that's affecting your vision, and that's very much tied to preeclampsia. Nausea. So every woman, almost every woman, gets nauseous in the first half of her pregnancy, what we typically call morning sickness. If it's happening in the second half of her pregnancy, that's not a good thing. A lot of times a physician or midwife might suspect that she's got the flu or maybe gallbladder problems, but that really shouldn't be the first thing they think about. If you've got nausea, vomiting, you really should be evaluated for preeclampsia, possibly. So another one is what's sometimes called epigastric pain, and that's a very medical term that basically means upper right belly pain. The interesting thing about epigastric pain, or sometimes it's called upper right quadrant pain, is many women experience this very differently. In fact, of all the symptoms, this is one of the ones that presents the most different amongst different women. So some women will complain about pain in their neck, some will complain about back pain, some will have pain radiating up and down their arms. We've had some women describe this epigastric pain as feeling like heartburn. Any of those are, again, not necessarily indicators of preeclampsia, but they're reasons that you should be getting to a healthcare provider and being evaluated for possibly having preeclampsia, or a variant of it called HELP syndrome. And that's especially relevant with epigastric pain, because the reason most women have that pain is because their liver has been affected. So once you start having that liver damage, that's usually an indication of HELP syndrome, which is very dangerous. Another symptom is really a shortness of breath, and I mean, this is not just like, oh, I just climbed a flight of steps and I'm huffing and puffing, which you can do even if you're not pregnant. But if you are really gasping for breath, if you're really feeling like you're panting and not getting oxygen, that again is not a good sign. You definitely want to go be evaluated. It may be an indication of something happening in your lungs, like them filling up with fluid, or some other things that could be indicators of preeclampsia. So those are the most common symptoms. Now, the last one that I always want to mention is one that you can't just put a label on, but it's the I'm just not feeling right symptom. And it's amazing how many women who look back on their preeclampsia experience and say, I just knew something wasn't right. I just knew I wasn't feeling right, and I couldn't describe it. I was feeling anxious. I had a feeling of like impending doom. All of those have turned out to really be what I call the maternal sixth sense, where we know our bodies and we know when something isn't quite right. And I guess what I would say with that is don't brush it off. Pay attention to that voice and get to health care. Have your blood pressure checked. Have them evaluate. You may need to have blood drawn to see what's going on with your liver enzymes, but it's worth following up to make sure that that feeling that you have isn't actually something more significant.
So, as a preeclampsia survivor yourself, can you talk just a little bit about what happens if preeclampsia or eclampsia or HELP syndrome goes untreated, and women may not recognize the symptoms and may not get to care when they need to?
So the worst thing that can happen is to not have it diagnosed and have it continue. I mean, preeclampsia is it's a spectrum disorder, which basically means that if it keeps going, it's going to get worse. It does not reverse itself until you've delivered the baby, and that reversal process might take a while. So even after delivery, it's still a little bit of a dangerous period. It's like what I would say almost any medical situation, and that is when it's not diagnosed, it's going to get worse and worse, and literally be life-threatening to mom and her baby. And that's one of the reasons that we feel so passionate about making sure that women are aware of signs and symptoms they may be having, and then if they get to care on time, which we hope they will, that their care providers are also doing due diligence and evaluating them properly and looking for, could this be preeclampsia? Because the cost of missing that diagnosis is terrible. And I know, I've had preeclampsia twice. I talked to hundreds and hundreds of women who have had it, and the most infuriating, what I would call almost the senseless tragedies, are when we could have done something about it, but we just didn't get to care soon enough.
All right, well, thank you for that rundown of symptoms and what women should do. Can you please give us just a quick rundown of the 7 symptoms we want women to be aware of, and we'll wrap up for today.
Absolutely. So the things that women want to be aware of are swelling in the hands or face, weight gain of 5 pounds or more in a week, headaches that won't go away very easily, changes in vision, nausea or vomiting, upper right belly pain, and difficulty breathing or gasping. Those are the 7 most common symptoms. And further information about all of this, as you know, can be found at preeclampsia.org. It's a wonderful website with an enormous amount of information, not only about these signs and symptoms, but all kinds of related issues.
Thank you.
Thank you.